After dental implant surgery, a patient can expect some swelling, minimal discomfort, but pain medication is always recommended for the first evening, minimal to no bleeding afterwards, sometimes stitches, sometimes not. They still can eat whatever's comfortable. I usually recommend a soft diet for the first evening and then progress or advance after that for the second day. Oral hygiene, they can brush, they can rinse like normal just to be gentle in the area where the procedure was performed. It's not a bad procedure at all.
So when it's all said and done, how soon can they eat? Because they're never left without teeth, is that correct?
That same afternoon, that same evening, they should be eating, whether it's soup, whether it's pasta, whether it's mashed potatoes, well-cooked vegetables that they can mash with a fork. They should be eating that same afternoon or evening. Once the bleeding stops, I tell them to eat. Milkshakes, smoothies, just no straws.
So you do a lot of bone grafting, I guess, as an oral surgeon. So in what type of dental problems do you do this?
Bone grafting is typically performed in patients where the bone has melted away over the years, either because they've been wearing a denture or because they've been missing teeth for actually anywhere longer than 6 months. If the bone has started melting away. So if the bone is not wide, if it's not tall, to allow an implant to be placed, those are the candidates, or the ideal candidates for bone grafting.
So what type of bone do you use?
I use the patient's own bone, or we use what we call bottled bone, which can be a combination of freeze-dried, this may be too technical,
okay,
freeze-dried bone, or bovine-derived bone, which is basically purified bone from a cow.
Okay, and what are the frequently asked questions you hear about bone grafting? What do the patients want to know when they've been told this?
Does it hurt, and how much does it cost?
Okay. Okay. Well, does it hurt?
It's funny, the procedure, when I explain this procedure to patients, I always end it with, this does not hurt. What I showed you with the model, or what I showed you on my iPad, may look like it hurts, but this procedure does not hurt. But afterwards, you do want to take pain medication again for that first evening to play it safe.
So you show them on an iPad?
Correct.
Is that right? I mean, on
Yes.
your consults, you use your iPad?
Yes. Yes, I
right there with patients?
Yes, I show the procedure. It's a schematic diagram. There's not bloody slides. But I show the procedure. We can draw on the iPad with our finger and give them an idea of what to expect.
So the purpose of the bone graft, though, is because you want to
place a dental implant to replace a tooth, whether it's one implant or multiple implants, but basically to replace a tooth.